Italy has supported the Global Fund to fight AIDS, tuberculosis and malaria since its inception, contributing over 1.3 billion until now, and it is indeed one of the founding members. For the current period, the 2023-2025 cycle, Italy has increased its commitment by 15%, pledging 185 million. Euros, of course. This reaffirmed commitment reflects our belief that health is a universal right and a cornerstone of sustainable development. Through the Global Fund, we are helping to save over 50 million lives worldwide and supporting over 24 million people with antiretroviral therapy, millions more with TB treatment and life-saving malaria prevention. In line with the 2024-2026 strategy, jointly adopted by the Global Fund, the Government of Kenya, and health partners, this project supports the national goals of reducing new HIV infection by 75%, AIDS-related mortality by 50%, and mother-to-child transmission rates to below 5%. Equally ambitious are the objectives for tuberculosis, a reduction of 80% in incidence and 90% in mortality by 2030. It would be naive to consider these goals easy to be reached, but we can do it if we work together across sectors, borders, and communities. We all know that normally ideals and reality do not coincide, as they are opposite concepts. But our action and behaviors must be oriented towards those ideals that we consider important for our adventure in life. The Coach initiative works according to this action and embraces the spirit of collaboration by strengthening the local health system and improving community-based HIV and TB prevention and care in Machakos County, especially in the Mwala Sub-County. Particular attention is focused on preventing vertical transmission, improving early diagnosis on HIV, TB co-infections, and offering individualized care thanks to the efforts of trained community health promoters. Moreover, the project places a strong emphasis on operational research, aiming to generate actionable evidence to inform policy, strengthening health service delivery, and promote sustainable and inclusive health models. The project also aims at introducing practices including the slow medicine approach. This means appropriate inclusion and respect for the individuals as a decision maker in their own care. It also introduces the most advanced principles of gender medicine as well, making sure that there is an inclusive and gender-sensitive approach to health access. Italy remains proud to stand alongside Kenya in this journey, and we will continue to support efforts that bring us closer to the dream of an AIDS-free generation and a world without tuberculosis. These initiatives boost the power of partnership between governments, civil society, academia, and communities. It not only reflects a shared belief in equity, dignity, and health as a fundamental human right, but it also confirms the deep friendship which exists between our peoples. Allow me to conclude by extending my sincere appreciation to all the implementing partners and community stakeholders whose dedication and passion have been and are at the heart of this project.
Whichever time we have a community is not well sensitized, we are lacking on the information. We are not achieving. Project will come and it will finish. And if we don't have that sustainability mission, we will not be able to get that. And that's why we are all here together, so that we can work together in the way that every project, it starts and it's finished with a sustainable manner. The main aim of Machakos is not only on the implementation of the project, but it's passing the sustainability and living a good practice in a community, so that we can have, once the project is ended, we have a community that is well sensitized. Because
we were even able able to select the healthcare providers that we need. Although that process is still on, we also worked in collaboration with the Minister of Education, where we need to identify 8 institutions to work with. So I want to say we are on track. And for us to have our ambassador today, at least to praise this project, to start off and we move, we really appreciate this. So I want to welcome each one of us as we begin together, and more so to the Mwala team, because now we will be doing most of the things in Mwala. Mwala team, I know through our MOH, is going to promise us that is going to hold that project up to the final. We are going to collaborate together so that we may achieve together. For all key stakeholders, we know that HIV is not a one-man's agenda. It is about all of us.
The Global Fund invests close to $4 billion in a year. And since 2002, the Global Fund partnership has saved over 65 million lives. Over 65 million lives. And the death rate for HIV has reduced by 63%. And therefore, as I stand here, join me please by giving a round of applause to the Republic of Italy for the pledges to the Global Fund replenishment over 185 million, because this is also part of the grants that we've continued to receive. In Kenya, currently, we are implementing a Global Fund grant of $407 million. And we started this last year, and it's running up to 2027. This is inclusive of the support we've continued to receive from the Republic of Italy. And I will be mentioning what is happening for the 8th replenishment. Your Excellency, through this support, we've seen a number of achievements. In our country right now, we have over 1.4 million persons living with HIV who are on under retroviral treatment. You know, this is a life-saving therapy, and through the support from the partners of the Global Fund, then we have been able to save lives in our country. The death rates have decreased for HIV by 43%. In the wake of HIV pandemic in 1980s, 1990s, the death rate was high, and Regina can attest to this. But based on the support that we've continued to receive from the Global Fund, from the government of Kenya and other partners, the death rate has reduced. We continue to appreciate the support we have been getting from the 5% Italian Technical Cooperation Agency. A number of organizations I know submitted proposals, but Your Excellency, the Ambassador, allow me to congratulate Novell for the approval that was granted, and it is evident from this meeting that this support is needed in Machakos County. This year, the Global Fund aims to raise $18 billion, and this comes from development countries, from donor countries, and from even host countries. And therefore, it is a moment when we are showcasing Global Fund success stories.
Psychosocial support groups, and for this activity we specifically intend to target the male population, as they have been forgotten within our health program.
Let's pray. Father God in heaven, we want to thank you because you are God. Thank you for this wonderful morning. And as we begin to host our ambassador of Italy in this place.
You know, I've been working with the young people, and today we have opportunity.
Before we leave for lunch, because I know some of us we have a general statement So maybe we'll guide you on how to sign them.
So because Lena will give the presentation, so I'll give her now to directors where we'll be taking our meals because she gave us some cards. Allow me to give. I think the workshop is closed now. Thank you very much. Thank you. Something. Finally, thank you all. Thank you the team from Mwala. Same, I want to thank the Ministry of Health, Regina. There's also Jeffrey, the youth public. I will come to Machakos for this project, which is within our heart. The same thank you. Closing remarks for this meeting. Mr. Joseph Gary. Yes. And without giving the opportunity, I may not receive my check at the end of this month. And okay. But one of the key things that we should not, when you work with the young people.
And within the Youth Friendly Center, we'll have HIV testing and SGBV, sexual and gender-based violence. The community barazas, 30 of them. 2 per health training will happen also in the second quarter. On activity 2, school sensitization events, we'll have 2 events per year, but in total, we need to recruit the mentor mothers, and this will be in collaboration with the Ministry of our partner University of Verona, and it comes in handy because they'll be trending psychosocial support group for this age cohort, or rather these patients. 97% of the notified TB and HIV patients, HIV positive, 20 to 23, 2021 to 2020, around 5% if I'm not wrong. In Machakos County, the services, PMTCT, prevention of mother to child services is at 87%, and this is 9.1%. This is why we are going to focus on Machakos County to help reduce this percentage to less than 5%. 15% of first ANC visits, that is by girls aged 10 to 19%, HIV, that is 1,378,000, and the third for TB among people living with HIV. The project entails the activities that we hope to implement within the
I think we are good to go, so that's enough.
And what we plan to do in the new project. So welcome so much. I also want to appreciate.
Thank you very much, Muya. I also thank you very much, Your Excellency.
3, 2, 1, go! Yeah. And I see you warming your hands, warm your hands, warm your hands. Amazing.
County Commissioner, the County Health Management team from Machakos.
My name is Lilian Atieno, working for Machakos Italia, and for the new project I'll be serving as the project officer.
Thank you very much, Casco. She's our mom, she's the mom of the county. Without her blessing.
For Mwala Sub-County, we have nearly 6,000 people living with HIV, which is the second highest for Machakos County. Mwala is the second sub-county with early pregnancies, that is 363 cases for the 10 to 19 years, 477 cases for the age cohort of 20 to 24, and this period is between January to August 2024, according to data provided by the Machakos County. HIV prevalence for the same sub-county for age cohort 15 to 49 years was at 3%, and the incidence of new infection was 0.27. And for the new project, some of the gaps that were identified was need to increase Act adherence and PMTCT effectiveness, because only 67% of the HIV exposed infants receive a virological test within 2 months. And ideally, all HIV-infected infants should be receiving the tests within the first 6 weeks. Another gap was need for integrated youth-centered approaches to prevention and care, and this is where the youth-friendly centers come in. We tried this with BioSafe, and this was a learning point from the BioSafe project. And also the PMTCT coverage rate is at 7.8% for Mwala Sub-County. The specific objective of COACH, it will target to strengthen integrated and individual community-based prevention and treatment services for HIV and TB, HIV co-infection in Machakos County. Result 1 will be to strengthen the social health system for community-based HIV prevention and individualized care for people living with HIV. Result area 2 will be strengthening integrated healthcare services for the prevention of vertical transmission within the HIV-TB package. For Machakos County in 2022, the county had approximately 569 new infections, and within the 569, 469 were adults and 100 were children. The prevalence rate for the 15 to 49 age group was 3.2%. The vertical transmission remains high at 7.3%. Ideally, this should be at around 5% if I'm not wrong. In Machakos County, the services, PMTCT, prevention of mother to child services is at 87%, and this is 9.1%. This is why we are going to focus on Machakos County to help reduce this percentage to less than 5%. On data for early pregnancy and GBV, 15% of first ANC visits, that is by girls aged 10 to 19%, and 2% are aged between 10 to 14. 37% of the reported GBV cases involved adolescents and young girls, and 44% of these 37% were children and adolescents. In Machakos County, 15% of the ANC visits reported, 15% of them were by girls who are between age 10 to 19, and 38% of SGBV cases reported at the county level is the age group 10 to 17. And at the local level, for the number of people living with HIV, that is 1,378,000, and the third for TB among people living with HIV. And for Machakos County, we have 34,604 people living with HIV. That is in accordance with the data provided by Ministry of Health in 2023. And this makes Machakos County among the seventh among the 47 counties living in HIV burden. County Directorate of Health, they will ensure a systemic approach with an impact on the services, and also they will support on the training.